I have a great pleasure to talk to Dr. Better.
Hi, how are you?
Hello. I would like to ask you a few questions about the sinus lift procedure. I know you are going to have a lecture about this topic.
Yeah, the sinus lift is a very needed procedure in dental implantology, and it's actually an obstacle which we have to go through in order to get implants in the posterior maxilla.
How do you think, in your opinion, it's a predictable procedure?
The sinus lift is a very predictable procedure. You just have to be qualified and know how to do it precisely in order to get very good results.
So to do it, when we do the sinus lift from the window, is it a procedure for regular dentists or young implantologists? How do you think, or how it's gonna look like when we use the balloon procedure?
You have to be an experienced dentist or implantology or a specialist in order to do a lateral approach to the maxillary sinus. But there are options nowadays which can make it easier, especially in a crestal approach, in order to get the same efficacy as in the lateral sinus approach in a very easier and predictable manner without the need of a very sophisticated technical approach.
And what kind of situation we can use this kind of procedure you're going to talk during the lecture?
The maxillan procedure is intended for cases which we have at least 3 millimeters of bone. The residual bone has to be 3 millimeters and above. And from that on, we can raise the membrane for at least another 10 millimeters above those 3 millimeters of residual bone.
What do you think about the membrane condition? Sometimes we have periodontal patient with periodontal problems, and we open the window, and the membrane is so delicate that it's almost impossible to make a predictable procedure.
I agree with you. I usually like to do a sinus lift not in the same procedure as extractions. So first of all, deal with the periodontal disease, extract the teeth which you have to get rid of, and only then after healing do the sinus lift procedure. In that way, I think you are going to get a more predictable results, and the membrane will be easier to elevate and separate from the sinus floor.
I have a specific question. Today I had a patient that I wanted to make this lateral window approach procedure, and the membrane was impossible to push because it was so thin. So do you think what we can do in this situation?
Usually when the membrane is very thin, this is something which you see in the preoperative CT scan, and usually you're going to get a membrane like that in a heavy smoker. Heavy smokers sometimes have a very thick membrane, and on the other hand they have a very narrow and fragile membrane. So if the patient is a smoker, you have to be alert and prepare for that, and sometimes you have to repair the membrane after you have elevated it in a lateral approach. By the way, the hydraulic system which we are using is easier in terms of separating the membrane from the bone, by that the force is gently applied on the membrane, and it's always in 90 degrees to the surface of the membrane. So it makes it easier to elevate the membrane, especially in cases when the membrane is stuck or adheres very strongly to the bony walls of the sinus. So this is actually a solution for those cases.
Do you think when we have a patient with periodontal problem, sometimes it's not possible to make this sinus lift elevator procedure because usually next to the roots the membrane could be destroyed?
I think that the periodontal disease is a problem in all dental implants, and it doesn't really matter if it's a sinus lift or it's just an implant in the lower jaw. First, you have to deal with the periodontal disease and get the patient to be stable, and only after that you can go for dental implants, because dental implants usually suffer from periodontal disease. So you have to be minded to those cases and don't rush to dental implants.
Could you tell us something about the raised sinus lift procedure system? What are the steps we have to make?
Okay, actually there are a few small steps. First of all, we open the gingival flap usually. We drill until the floor of the sinus. We have a special diamond drill which penetrates into the floor of the sinus under the Schneiderian membrane without tearing the Schneiderian membrane. And then we screw in the specialized dental implant, which is called I-raise. On the second stage, there is a tube connector which we screw on the implant and inject 2 cc's of saline solution gently into the subschneiderian space, and by that we are elevating the Schneiderian membrane from the floor of the sinus. Then we sit the patient upright and pull on the syringe and take the saline out of the sinus, and we create a space to inject bone graft solution, which comes on a gel formulation. We inject the bone graft gel into the sinus, and then we can just simply fully insert the dental implant into the sinus, and we already have a dental implant inside the bone graft in the maxillary sinus. So actually it's a very simple and very fast procedure. And the big advantage, it's easy for the dental practitioner to perform. It doesn't have to be a specialist. And secondly, there is almost none or zero postoperative pains or swelling due to the fact that the flap and the opening in the bone is very, very small. So it's a big advantage from the side of the dentist and from the side or in the point of view of the patient.
It is said that we can put into the sinus any kind of biomaterials. Is it artificial or from the animal? Do you agree with this opinion?
I agree. It doesn't really matter which material you insert into the sinus. The literature says that every material is going to get you good results. There isn't really a big differences between the different materials in the sinus due to the fact that it's a confined and closed space which heals quite nicely.
And how long you advise to wait until this procedure?
I advise the clinician to wait between 6 to 9 months before loading of the case. It depends on the occlusal scheme, it depends on how many implants there are, the amount of residual bone, and etc. So between 6 to 9 months. Actually, we don't change the biology of sinus lift. It's actually the same. We only change the way we insert the bone graft into the sinus. The biology is going to be the same.
And what do you think about the procedure that we make the sinus lift and the implant procedure?
It's a well-known for the last 30 years to do the implants and the sinus in the same procedure. It's an excellent way to save time, to save surgeries, to save pain, and so on. So this is actually the right way to do it.
And what kind of medicaments you prescribe after the procedure or before the procedure? Do we need to use antibiotics and so on?
I usually give the patients preoperative antibiotics, nose drops, and mouth rinses which has chlorhexidine inside. This is my protocol, and a little bit of a painkiller. Usually in the maxillan procedure, patient doesn't really need a painkiller, but they're always happy that they have it, with them. But they're not supposed to have a lot of pain.